In this video, we'd like to make a small presentation for you of the cosmetic services which we offer at this facility. I think that one of the major problems that affect so many women is that of varicose veins. I don't mean to say that men don't suffer this condition, of course, but it's less common. We can classify varicose veins according to their size. First, we have what is known as spider veins, because they are very fine and appear in groups, principally over the thigh area of women who have been pregnant. These veins can be treated either with laser or with sclerotherapy, which I will explain shortly. The laser functions by applying an intense ray of light over the veins in such a way that the blood within it coagulates and disappears. We have two types of laser, the KTP and the intensive pulse light. The KTP is a point of light which emits 1 to 5 pulsations per second, depending on which kind of energy we choose. As you can see here, it's like drawing the vein with a laser point. This vein disappears little by little as we continue to pass the laser over it. We apply a topical anesthetic cream half an hour before the treatment in order to minimize any discomfort which may result. The advantage of using this laser is that we do not need to introduce any substance into the body, and it does not need compression afterwards. However, we usually need between 4 to 6 treatments in order to totally eliminate all the little veins, especially in the leg areas. But also, this laser can be used on any part of the body in the elimination of a spider vein, and is especially effective of the areas of the face and the nose. It usually requires fewer numbers of treatment than in the leg areas. Now, after the treatment, this scab formed of the areas where the vein used to be fall off in less than 2 weeks and should not be rubbed or picked. We can perform similar procedures with the other laser, known as intense pulse light. The advantage of using this kind of laser is that each pulse covers a much larger area, so that the discomfort is far less. The disadvantages, again, are that we may need to repeat several treatments in order to obtain the desired results. But the consensus among those of us who treat a lot of varicose veins is that the preferred method for treatment of veins of the legs is sclerotherapy. This method consists of very tiny injections into the veins with a substance which cauterizes them and causes them to disappear. As you can see, in the moment the substance reaches the interior of the vein, it disappears. It is common for an image or shadow of the vein to reappear a few moments later. This is caused by the coagulated blood inside the vein wall, which needs to be reabsorbed by the body and will go in time. There is usually some inflammation of the skin directly over the earlier vein due to its reaction to the substance, but this disappears quickly. There are a variety of substances which can be used for these procedures, but the safest and the one which produces the best results is sodium tetradecyl. We have years of experience using this substance, and with very few or no side effects. For treatment of larger varicose vein, it is more effective to utilize a foam mixture of the same liquid. Mixing it with equal parts of air. Whether we use the foam or the liquid, one of the most important steps of the treatment is the compression, which follows these procedures. We achieve this by applying gauzes immediately over the treated veins, wrapping it, and then using an elastic stocking of precise pressure. This helps extraordinarily to keep the veins which we have just treated firmly closed so that they never open again. These stockings should be worn for 2 to 3 days without removal to ensure the most beautiful results. The final product, for the immense majority of the people, is very pleasing, as you can see from these following images.